Good evening to all the viewers who are watching live. I hope you are enjoying our past CMEs, which we have done, and it is a great pleasure to have with us an eminent speaker, and that part will be covered up by rest of the panelists. And again, we have wasted 4 minutes, and let's not waste any more time and begin with our 30 seconds countdown.
Good evening, everybody. Good evening, sir.
Good evening.
Tonight, we are proud to announce that we are going to host our 48th online CME being conducted by National Institute of Homeopathy Alumni Association. And tonight, I am sharing the screen with my co-host, our sir, our president, Dr. Narayan Kalyani, sir. And tonight, we have a host of stars of NIH alumni who are going to be in the presentation arena, starting with our president, sir, with his permission. Let us call upon on screen our inaugurator tonight. Sir,
Sure. Please call him.
thank you, sir. Our inaugurator tonight is Professor Dr. Rajat Kumar Pal, one of the brightest stars of NIH, and we are proud, Rajat, to have you with us on the screen. Rajat sir has been both UG and PG from NIH. So over to you, Professor Rajat Kumar Pal, to inaugurate tonight's CM.
Good evening. Thank you, everybody. I am very happy to be present in this virtual platform on the occasion of 48th CME run by your prestigious NIH Alumni Association. Also, I feel privileged to inaugurate this virtual 48th CME program. I would like to extend my gratitude to my respected teacher. He is our president of the association, Dr. Devnaran Kalyani sir, and my senior Dada, Dr. Bidyut Kumar Mukherjee, who are taking responsibility to continue the CME program uninterruptedly with great success. Myself spent many years in National Institute of Homeopathy since 1990 to 2004 for completing my BHMS and MD Homeopathy, but with a very small gap of 2 years for joining in my service in education service. We have grown up from a homeopathic student to a homeopathic physician under excellent care and guidance of different dedicated teachers like D.N. Kalyani sir, Professor Dr. Shaumendu Adhikari sir, Dr. Shunirmal Sarkar sir, Professor Dr. Ilim Khan sir, and Professor Dr. Samir Kumar Bhattacharya, and many more. Today, we are very fortunate that Professor Dr. Samir Kumar Bhattacharya sir present as a moderator. He is ex-HOD Mathematics, ex-director of our NIH, former governing body member of NIH. He is a teacher of teachers with a vast clinical experience. I should say something why this session is very, very important. According to Dr. Emil Tyler, in different ways of looking at remedy, he said, no great work has been done without great effort. and great self-sacrifice. In homeopathy, the remedy is thing, potency, and administrations are the questions that divide us, are matters of personal experience. Brilliant work has been done by people of widely different range of potencies and administrations, provided that they have found the remedy. Without this remedy, the magic refused to work. Homeopathy is not for lazy one, but our immensely wider range of medicines is compensated by foolish repertory. So repertory is very, very important in our day-to-day practice. Today, we are so fortunate that we have legendary speaker, our ex-student, Professor Dr. Shashi Tiwari sir. He will speak on repertory in our day-to-day clinical practice. I believe through this speech, we will be enriched, and surely our students and other viewers will be benefited a lot. Our Dr. Shashikant Tiwari sir, presently working as guide for PhD students in homeopathy, University Jaipur, India. He has established his own clinic in Mangalore, Karnataka. He has been practicing homeopathy for more than 32 years. Around 21,000 families and around Mangalore have registered in his clinical for medical treatment and have been immensely helped by homeopathic treatment to maintain their health. He has served homeopathy in various capacities as director in IH, principal and professor Father Muller, Homeopathic Medical College, Mangalore, Dean of Education, Dr. Nielsen, Homeopathic Medical Research, Winnipeg, Canada, Chairman, Board of Studies, PG, Rajiv Gandhi University of Health Sciences, Bangalore. He has authored very important book that is the Essentials of Repertorization and Homeopathy and Childcare. In association with Central Council Research in Homeopathy, Government of India, Dr. Tiwari sir has authored several books like Menopause, Diabetes mellitus, and Prescribing, etc. He has served CCRH as expert in various committees. Now, I am handed over this mic to our moderator, sir, our respected teacher, Dr. Kumar Bhattacharya. Sir, please.
Good evening, doctors. It is my privilege that the organizers has invited me to act as moderator in this subject. This subject, I'm telling you, this is a very important subject for us. We are brought up in Calcutta environment. I'm a student of Calcutta Homeopathic Medical College. Though I have also passed DPNIH from National Institute of Homeopathy, but before that, repertory was not very well known to us, and we were brought up under the guidance of our so many genius teachers, Dr. S.P. Day, Dr. P.C. Pal, Dr. S.K. Dubey, Dr. B.K. Bose, all are masters of keynote prescribing, and our brain from the very beginning was sensitized with the keynote prescribing. So until I joined National Institute of Homeopathy as a student that time, I had no idea about this matter, and practically I am telling you, in our DMS, I am not from BHMS, I am from DMS. There was no subject of repertory also at that time. So after coming to National Institute of Homeopathy, when I was exposed to repertorial systems, and I was taught by different very good teachers of repertory all over India. Then gradually I became interested and I came to know some parts of the repertory. I am not a repertory expert like Dr. Rajat Pal. I am not a expert like Dr. Shashikant Tiwari. They are expert in the subject. They are teacher of repertory. But I also know the importance of this repertory. I will tell you only two things from where you will understand that how repertory is so much important in day-to-day practice. Definitely, the main speaker will enrich your knowledge further. Now, I am quoting one case of Dr. B.N. Kanjilal, our teacher, and the student was our ex NIH student, Dr. Basanti Gupta. She had a severe respiratory problem, and when no medicine could relieve him from the allopathic side or keynote prescribing this, that time, Dr. B.N. Kanjilal was requested to see the case. He saw the case and he found that she is getting relief only by kneeling position. So this is the keynote, and on that keynote prescription, keynote indication, Dr. Kanjilal prescribed Medorinum, and there was miracle for some time. The symptoms was gone. She was all right for 1 or 2 years, I can remember. But suddenly we heard that there was some aggravation and she was expired. Now the question came to my mind, when by a keynote a medicine was given and showed such miracle, then how it reappeared and how the patient expired. So that time I discussed it with many persons and came to a conclusion that by keynote it is not always that it will cover the entire totality of symptoms. And it covered one keynote symptoms which gave relief, but ultimately the patient was not cured. So, what is the remedy? The remedy is here that along with this keynote prescribing, we can think of the repertory, and with the repertory only, we can find a good totality of symptoms for a patient and prescribe. And the chance of this type of chance as further aggravation is will be very less with the with prescription of repertorial prescription. So this is I wanted to tell. Another one thing I will tell you, just very small case. In National Institute of Homeopathy, when we were taught repertory with different teachers, then one patient came. I can remember the case, Narayan, and he came with severe liver damage, right-sided cardiac failure, and entire body was swelled with water. Now, after he was admitted in my bed. I took the case, I repertorized, and simply with the repertorial analysis and repertorization, I selected the medicine which came top. That is, at that time I was very, I had limited knowledge. So that time, which came first, number one, scoring top, I prescribed arsenicum album in 50 millisiemens scale. I prescribed it. Gradually, past 7 days, the patient was gradually decreasing. That means edema was being more. The patient was not relieved at all. But I thought if my repertorization is correct, he should be relieved. So I was prescribing, continuing the medicine. And after that, On 10th day, I can still remember. We went back to our house, and in the morning when I came, I could not recognize the patient. What happened? Throughout the night, that patient passed urine and became shrinked, and his physical appearance was changed. So, since then, I realized by totality of symptoms through repertorization is a good way of prescribing. Still, I am telling, I am not a master of repertory. Master is Rajat Chatterjee, Rajat Pal. A master is Dr. Shashikant Tiwari, from where you will hear the art properly. And Dr. Tiwari is not only a good repertorization teacher, but also I consider him is a good homeopathic teacher. So let us hear from him. We have seen when he was in National Institute of Homeopathy as director, few cases, but we could not see him as a prescriber very much. So let us hear him, and I request Dr. Tiwari to give such thing so that not only the students, not only the our juniors, but also myself become benefited from his sharing knowledge. Thank you, Dr. Shashikanta Tiwari. Please take over the charge. Orko Mukherjee, do you hear me? Is there any problem?
Sir, extremely sorry for the weird but we were facing some technical issues from our ID team. Sir, you can continue.
Who should continue?
Yes, Dr. Tiwari, you please enlighten us.
Okay. Can you see my presentation?
No, sir, it's not visible. You have to do that again, sir.
Okay.
The process, sir.
So I have to go to
Once
share
you just
again.
cut
Yeah.
off, it just cuts off. Yes, sir. Now it's visible. Just open your presentation, sir. Yes,
Is
sir.
it okay?
Yes, sir. Yes, sir. It's okay. Just turn on the slideshow, sir.
Yeah, wait, something has come up.
Okay, sir.
Something has come up. No, on my screen, something has come up.
Sir. Yes, sir. Just cross that out, sir.
Huh?
Just cross that out, sir.
No, I am not able to remove that. Manish,
So,
can you ask
yes, sir. Just cross it out, sir.
1 minute?
Okay, sir. Or else you just click on the screen, sir. Just click on the screen, sir. Once
Something has
means
come
on your
up.
presentation. Just click on the presentation, sir. Once it will go away.
No, where from this time?
Uh, okay, sir. We are waiting, sir.
So, shit. Is it visible now? Is it visible?
Yes, sir. Yes, sir. It's visible,
Okay.
sir.
Okay. So, good evening, everybody. And I must thank the organizers for inviting me for this talk on repertory. And I also thank my good friend, Dr. Bhattacharya. He's a good human being, my good friend. So he had very good word for me. Thank you, sir, very much. And I thank the organizer for selecting this subject and me for this subject. So today's topic is the use of repertory in day-to-day practice. Let us begin with the introduction. The aim of day-to-day practice is to cure, which is possible only if a physician is able to select the most similar medicine or the simillimum for a sick. This we have been studying from the first year. The first aphorism, the organon, highlights this from first year till MD in organ, and this is common for all the subjects. So this principle we have to keep always in the mind: cure and totality. Since the system is based on nature's law of cure, that is similia similibus curanter, a physician arrives at totality of the patient first and then search for the similar picture in our materia medica to find a remedy which is matching to the disease and the sick on the basis of similarity. Reporterization is the only means when I say, I am not discouraging other means, but only means the right approach with full-fledged principles and system. So repertorization is the only means which helps in search and suggests the right remedy or a small group of similar medicines totality of symptom is considered as the basis of repertorization. What our stalwarts told about the therapeutic way, the clinical practice. From this, I am quoting from Organ of Medicine, from this indubitable truth that besides the totality of symptoms, nothing can by and any means be discovered in disease wherewith they could express their need of aid. It follows undeniably that sum of all the symptoms in each individual case of disease must be the sole indication, the sole guide to direct us in choice of remedy. And what is special in homeopathic prescribing? Why we go for the basis of totality? Homeopathic practice does not merely depend on diagnosis of disease, but it also takes into account the understanding of the person, that is, sick person. Totality of symptoms becomes the basis of prescription, and understanding the totality will lead to the portrait of disease that is in organ. This portrait has to be matched with the image of medicine. See, this is the main work. Some of the stalwarts also have said a homeopathy physician is a matchmaker between patient and the materia medica. And if he is rightly able to make the match, he is a successful physician. This is truly seen in all the practices of homeopathy. Unless there is similarity, we can't use the case. We study the medicine in materia medica from the point of understanding the image. Now, see, when we study lycopodium, when we study natrum, we find what is the characteristic, where is the person in lyco, where is the person in natrum, the whole matchmaking. But when we study so many of such type, then all the pictures are sometimes where it mixed together, and that is where the repertory helps you. So find a correct match is the function of repertory. It needs a skill to create a disease picture and drug picture in case taking. So what we do in case taking also we do the same thing, and the study of materia medica respectively. In other sense, a physician needs to have an art of knowing the patient and knowing the medicine in totality. Therefore, it is obligatory in homeopathic prescribing to learn and master the art of prescribing. Aim of physician is in prescribing should be to look for medicine which is as closely similar to the picture of sick as possible, to match the portrait of disease to the image of medicine. Here the role of repertorization becomes very important, crucial and obligatory. Now let us come to know. We talk of repertory, totality. What actually repertory is and what is repertorization? How does we understand and how does we can make use of it? Repertory is a useful and practical discipline in homeopathic system of medicine. I always encourage in our lectures and all those that repertory cannot be just theoretical. We cannot be just memorizing rubrics and hunting rubrics, but it has to be understanding of the whole principle, and it's a practical subject. Everything we teach, like Bonington, Kant, and all that, it has to be applied and shown to the demonstrated to the students. This deals with indexing the whole content of homeopathic materia medica. Now, just imagine the whole materia medica. Like you must have seen Herring materia medica, 10 volumes. Indexing the whole thing is not a joke. And other materia medicas too, the clinical practice too, taking all the materials of clinical, you can say, toxicological, proving, and making one index following a particular system and logic is also very difficult task, which our stalwart did it and shown the way. So it's a systematic and logical way based on some definite principle. So that now why we have systematized and made on principle, because the finding of needed symptom in sea of materia medica becomes easy and prompt. From all the references about repertories, we can understand that repertory is a device. Now, this word is very popular, device. Repertory also is a device with a purpose to make the task of finding symptoms and their medicine in an easy way. So, we can define homeopathic repertory as a systematic, logically arranged index to homeopathic materia medica, which is full of information collected from all these sources like toxicology, drug proving, and clinical practices. Now the question comes, why the index is so important? If it is just index, no. It is not a simple index or back pages of materia medica. It's a practical device to help a physician to find the symptoms and thus match the totality of the patient to finally get the minimum out of many similar. See what happens when you take the case, we find so many medicines run in our mind. Patient tells one symptom, 4 5 medicine. Another symptom, 4 5 medicine. And finally, sometimes we are not able to make it very clear what it is unless we refer report. The use of repertory in homeopathic practice is a necessity. This I am quoting from J.T. Kent. If one is to do careful work, our mathematica is so cumbersome without a repertory that the best prescriber must meet the only indifferent result. At this point, I would like to share you. See all the stalwarts, J.T. Kent, Boger, Boninghausen, Hahnemann, they were masters not only in repertory and mathematica, everything. See, organon, Kent is a master. Mathematica, he is master. Repertory is master. Similarly, Boger, his philosophy book you must have read, Healing Principles, and Mathematica, Synoptic Key, as well as his repertory. Boninghausen also. So all this, unless you have knowledge of totality of these three subjects, you can't go ahead in homeopathy practice. So Kent is emphasizing that along with Mathematica, you must be master in repertory. Hahnemann has expressed his thought on prescribing in aphorism 153. This everybody knows. This is about what is important symptom, what is not important symptom. But what I want to show is he has a footnote where he is telling about repertorization. Footnote of this, he tells Dr. Boninghausen by the publication of characteristic symptoms of homeopathic medicine and repertory has rendered a great service to homeopathy as well as J.H.G. Jar in his handbook of principal symptoms. So Hahnemann was happy with these two books because his dream was repertory is mathematica is becoming cumbersome, heavy, loaded with lot of symptoms. So his dream was there should be some device which can help a physician to get into homeopathy mathematica easily and find out totality. So he was happy with these books and he mentioned. Now we'll see what they feel about Boninghausen and Bogart. Just little about that. The process of repertorization is the application of repertory into its full potential use, and that is to find a match of totality that is the simillimum. And Boninghausen feels that it is expedient. See, like we are talking about computer. He has thought earlier only that repertory is expedient, which makes things easy and speedy. And now we have opened we have searched the device which can give you things in a minute, in a click. But they have thought this that repertory has to be there and it should be called as expedient. What Kent says is the success of prescribing depends on the view taken of the totality of symptoms. The view of any given totality affords the indifferent or the marked success of any given prescription. So he gives importance to totality. To be able to view the totality of symptom so that the most similar remedy will appear to the mind, the aim of all healing artists. As the view varies, so varies the success. See why we vary. Some people, ask in one of my seminar, why 2 3 homeopaths don't prescribe one? I said no, this is not true. If 2 3 homeopaths homeopaths follow the correct totality, the correct medicine will come and they will prescribe one. Why they differ is because the view differs. They view patient in different way, they view totality in different way. So views will be different. Success also will be different depending on the prescription. But if two of homeopathic physicians follow strict totality, the medicine will be same. I can give you guarantee. And what he is telling is the pathological ultimate symptoms are the least value. But a physician must have a good and full knowledge of all this, as well as of anatomy and physiology, or he will not have the basis of good judgment and hence will form a distorted views. So this is the all view of Kant. Why I emphasize this? Because in repertory and repertorization, analysis is very important. And all this view shows that analysis means separate common symptoms and uncommon symptoms and make the totality with uncommon symptoms. And I will just share about what Boger says, because these three people are the pillars of repertory. Boger says correct prescribing is the art of carefully fitting pathogenetic to clinical symptoms. And it requires what? A special aptness in grasping the essential points of symptoms image. And then he said that great knowledge in mastering materia medica. And then he gives option or a most skillful use of repertory. If the first one and two you don't have, skillful use of repertory will solve your problem. And these are the people must be remembered for repertory. See the above, our master. Master is master in everything. Hanuman, next Boningation, and then Kent, Nar, Clark. He gave origin to the clinical repertory. This is concordance, and the finally Boger. So all these amalgamations, and you will find in Boger, but still all are important. In summarizing about the repertory and case, what we need for repertorization, what we look like, what we look for totality, same thing we look for a repertorial totality also. Modalities, because I am putting whatever is easy, step by step. Modalities, because every patient will come and mention modality and the complaint. So C modalities, aggravating factor, ameliorating factor, which includes general and particular modalities. And that if you get causation and time, it becomes very important. Then in relation to temperature, weather, open air, posture, motion, eating, drinking, sleep, alone, pressure, these are all modalities. What, how they change the symptoms. Then all uncommon symptoms in the person. So that is how I mentioned that Kant's view. All uncommon symptoms you have to find out. Symptoms belongs to the whole person, like mental or physical. Pathological generals, tendencies are common nature of pathology. See, this does not mean pathological symptoms. It is a general pathology. General pathology means the tendencies and some of the diathesis. They are the part of the person's constitution. And lastly, concomitants are very important. Sir was telling about keynote. Keynotes sometimes we take wrong. As per Gurnasi, he defined them as symptoms representing the whole remedy. That means you take hold of one symptom, but finally you will see that it aggravates the whole person. By getting such a symptom in case, one can be quite sure the rest of the case will fit into the same remedy picture. This needs a proper judgment. So this is not for everybody, I'll tell you. This is only for experienced person like our Bhattacharya, SK Dubey and all those. They must be seeing one symptom and understanding the whole person. Then it is important. We can see different views, but the purpose is same. How to get a totality and select a right remedy. There should be no confusion on this. Now, day-to-day practice, this was just introduction. What type of cases usually get? We get acute case and chronic case. This is a classification of disease given a master also. Chronic cases we get with characteristics and sometimes with dominant pathology and concomitants and sometimes with no characteristic. So all these cases have to be have a different approach and different type of strategy. Now this question is very often asked: is repertorization necessary in all cases? I will say yes, but the kind of repertorization will differ. One is mental repertorization. See, when we take the case also, our mind works. Our mind works logically. We go on differentiating. Sometimes experienced person you will see at the end of casing he says, this is the remedy, that's all. Kent also has said in one of his article that if you repertorize 100 cases, you don't require further repertorization because your mind works like a machine of repertorization. So mental repertorization many of us do without our knowledge. So that is why I say repertorization is a logical process which goes on in any prescription. Sometimes we are not able to have that kind of mind, so we have to work on the paper. So mental repertorization is done in every case for a homeopathic prescription. It's done by experienced practicing physician and knowledge of comparative mathematics is must in this. Second is referential repertorization. Sometimes, one or two symptoms we refer and we select the remedy. This is done by referring a few important rubrics to confirm or to compare the medicine in mind. And third is systematic repertorization, which every student must go through for a number of cases. Then he understands what is repertorization and he can do without repertory also. But it does have a different steps which we should follow. What are the methodology of repertorization? One is Bonninghausen, one is Boger, Kent, and clinical. Actually, there are only 4 methods. Bonninghausen in particular type of cases, Boger in particular type of cases, Kent in one type of cases, clinical where you don't get any characteristics. Acute cases. Acute diseases are defined as disease which begins suddenly, progress faster, everybody knows that, run a definite course and finally end either with recovery or death. They are caused by an exciting cause or acute mechanism. Contrary to general belief, the treatment of acute disease are much easier because sometimes acute disease means people say, let us not go to homeopath because acute cases they don't do much. But it's contrary to our belief, their belief that we have good medicine and we can come to faster and quick totality. And here also I will show you how repertory helps you. Hence, difficulties forming totality and selecting a remedy are minimized. While attending to acute case, the physician should be able to limit his inquiry to the recent deviation from the health. This was a case of intersusception. All of you know what is interception. I'm not going to explain it. Is a process in which a segment of intestine invaginates into the adjoining intestinal lumen, causing bowel obstruction. This was a 7-year-old boy which was diagnosed as intersusception, reported with severe abdominal pain. Here the pain will be too much. The pain was violent, used to come and go suddenly. Patient was brought for homeopathic treatment because he was advised hospitalization for observation and if needed to undergo some surgical procedure, which the parents wanted to avoid. Pain started suddenly at 3 a.m. in the night. He was given buttermilk, which relieved the pain a little, but pain continued. Morning, he was taken to a medical checkup to a nearby physician. The doctor suspected some worm infestation. At this age, people only suspect that, and gave some medicine. The whole day pain continued. Every 1 hour it used to come and go paroxysmally. Pain continued through the night and he was taken to Medical College Hospital. See, this is maybe after 14, 16 hours. Past history, the child had severe abdominal pain in May, for which he was treated in hospital. He was subject to the blood investigation and ultrasonography. The ultrasound revealed intersusception and he was advised admission. Since he preferred medical treatment, he contacted us. And this is the hospital record. See, actually, they have brought the whole hospital record because they came out from the hospital telling that we don't want any operation. And see that Pentop and all these painkillers and all this, the ultrasound shows that intersusception. These are hospital papers. On further inquiry, the following symptoms were found to be present. Child was very irritable with the pain. Anger used to increase the pain. The pain was better by pressure. Child was lying on abdomen and curled up. Passing of his stool, though very less, relieves pain. Hunger not reduced. He was asking for frequent food. Then we have done only reference method because in acute cases, because I don't do by computer repertorization. I do only by reference and systematic repertorization. Nowadays, my son is doing, so I can do that also. So irritable with the pain, we found so many medicines: Brania, Chamomilla, Colocin. Anger increases with the pain. Abdominal pain, pressure ameliorates. Abdominal, lying on ameliorates. Bending on double must ameliorates. Paroxysmal soft stool ameliorates. Colocin. See, throughout this, Colocin was common. See, once your totality and symptoms are clear, you can be sure about the result. And this is the group of remedies coming: Chamomilla, Shavisgra, Colocin, Bryonia. Because the prominent modalities, he was prescribed Colocin 200 every 2 hours for the pain till the pain subsided. Slowly, the severity of pain subsided, and in next 12 hours, the pain is stopped. After the pain subsided, he was prescribed a deep-acting medicine to complete the cure and prevent the further recurrence. He had the following symptoms, and these symptoms also we have repertorized. Child is thin built, liable to get digestive trouble, had problems during dentition, sweat on the head and profusely, weather changes causes cold and tonsillitis, craving for meat, chilly patient. You must have guessed the remedy. He was given Calcarea Phos 30 after repertorization. Pain is stopped completely since last evening, and he passed soft stool. Overall feels better, slept well. Then he was advised for ultrasonography. And here you see, I mean, uh, there is no evidence of any interception, and bowel mass, fluid, or abdominal sonography is normal. So this was one case where it was a little panic, but it took care because of the totality. This only also one small child with appendicitis, diagnosed case. 5 years old came for the treatment of diagnosed case of acute appendicitis, and he was treated by local measures for stomach pain initially. Then he was admitted to ICU for pain. When the pain, especially the vomiting, was a little better, he was referred for surgery, to which parents did not agree and wanted homeopathy treatment. And you can see I can show only this much. Tubular hypoechoic lesion in the right iliac fossa suggesting of acute appendicitis. Then again we have collected some symptoms and repertorized. Hot patient, moderately built, thirsty, takes water often and good quantity, dryness of mouth along with pain, craving for sweet things, peda, hot, jalebi and all this, cannot tolerate small corrections. This child, see, 5 years old, cannot tolerate a small correction, always feels I'm right. Irregular food habits, irregular bowels, and often pass foul gas. Pain better by hot application. Typical right side lumbar pain not better by vomiting. And we found Lyco was coming after repertorization. He was given Lyco 0/1, one dose daily for 3 weeks. And he was asked to report after that with ultrasound. See why we have asked. This patient is at least around 100 kilometers from here, and it was told that when pain is more, you have to inform and come here. Otherwise, if pain is getting better, continue for 3 weeks and then take ultrasound and come. Patient reported after 3 weeks with ultrasound, and then he found pain was getting better. Pain and all other symptoms stopped after 1 week, but reported by phone and was asked to continue like a 01 daily morning. And this ultrasound, you see, no sonological abnormality detected, and patient was better. No pain, appetite good, no vomiting, advised to discontinue the meds. Then these days, fever is a very common problem with the cold, with the viral problems. But how to treat a fever case with repertory? Some of my students were asking. See, for fever cases, we have to take what is called fever totality. So fever may have chill, heat, and sweat, these three stages. Or it may have only heat stage also. Nothing to worry. Whatever stage is present, we have to take the totality of that stage. So we have to qualify chill with time, type of chill, like partial, ascending, descending, whatever type. Then aggravating factor for the chill, emanating factor for the chill, and concomitant along with chill like thirst, headache, diarrhea, whatever, urination. Same thing we have to have heat stage and all these factors, time, type, aggravation, emulation, concomitant. Sweat stage also. If you get all three stages, take totality of the whole chill, heat, and sweat. If you get only heat stage, take totality of heat stage. And then repertoire. I'll suggest you there is one book, Bogus Boningness and Characteristic Repertory, and it has a very elaborate fever symptoms with lot of concomitants. Those who have not seen, please see that. You will be overwhelmed with the information available about the concomitants of all these stages. So look for the stage of the fever, chill, heat, sweat. Inquire about the symptoms during these, like time, type, aggravation, like chill. Same thing you do with the heat, time, type, aggravation, aggravation. Same way, you'll find in the repertory also the symptoms are arranged. Sweat also, all this. So take fever totality and you can do with that. I had many cases, but because I thought there will be a lot of time problem. Now come to the chronic cases where actually repertory is required and where the people and the stalwarts have said that we can't do without that. Now, chronic stages, if you want to do repertorization, you have to follow a definite steps. You have to do proper case taking, recording and interpretation. Important because see, recording we do a lot of mistakes. We have to put marks, like craving for sweet. We have to put either 3 marks, 2 marks, 1 marks. Craving for salt. Even aggravation, revelation, if you record with the markings, is good for repertory students. Then classification and evaluation of symptoms. Then you have to understand the problem. Defining problem means understand the patient and problem. Sometimes mechanically we can't go. We have to understand the whole person. Then comes to totality. Then whether it is non-repertorial or repertorial, you can decide. And then the prescription. Now for case taking, I am not going to discuss. I am just telling you what are the references available. See, first reference and very reliable and authentic references, Organ of Medicine from 83 to 100 for reference. Then Boninghurst and lesser writing, there are a lot of articles. Bogus studies in philosophy of healing. Kant's examination of patient is a very important chapter. Roberts also have written about taking the case. Stuart Close has written about examination of the patient. M.L. Dowle has written about receiving the case. It's a very nice heading. We are actually receiving the case, just not taking and keeping somewhere. And then in my book also, there is a chapter on case taking where a summary of everything is given. Then after case taking, decide the need of repertory, whether this case needs systematic repertorization, and if at all it needs repertorization, which repertory is required, which method is appropriate for the case. All this we have to decide for a right repertorization, for avoiding mechanical repertorization. Selection of repertory depends on what is available in the case. This I have been emphasizing since long time, because uh, see, recently also, or many times I have gone for examination. Sometimes all the students take the case with only Kent repertory, or mostly Kent, you can say. All other repertories are neglected. So it should not be like that. Kent is for those which fits for the Kent. Okay, if the case has cause effect clearly defined, or pathological general. See, cause effect means even if the emotionally some person is disturbed and getting symptoms, it's called cause and effect. Physically also something happened and getting symptoms. So cause effect if defined, and if there are pathological general tendencies, prominent modalities and concomitant, BBCR should be referred. Any other repertory may help, but BBCR should be the best. If the case has qualified mental, physical generals, characteristic particulars, go for the Kent repertory. If the case has complete symptoms like location, sensation, modalities, go for Boningen's method. If the case has no characteristic and only common symptoms, clinical repertories will help you. At this juncture, I must tell you, see, if you follow this method, you can use all these modern repertories. Take, for example, Murphy repertory. You can use Boningen's method. You can use Bogus method. You can use Kent's method also, because they have plenty of information. Only the methodology will be different. One chronic case I will like to present you. 13 years old girl reported for the treatment with the following complaints. She had back pain, low and middle, up to the neck, better by lying down. Aggravation, sitting and standing, and cold, and mornings. Shoulder pain, neck pain, hand pain, finger pain, all these are aggravated in the mornings. Leg pain, knee pain, see all the joints, you can say almost everywhere there is a pain. Second problem was frequent cold and cough in the morning, nose blocked till sunrise, and it's better by sun. Here all the complaints are caused and increased due to stress and anxiety, as it was very obvious before exams and before going to school. Patient was staying at Madikeri. There is a place here nearby where almost every time there is a rain. It's a cold place with heavy rainfalls for the major part of the year. She used to get exposed to cold and rains, used to suffer from cold very often. She also found the study was a difficult task to her. Often she used to be nervous in the school when she was asked to stand and answer. Slowly she started getting back pain while sitting long in the school, and next to that she started hand pain while completing the homework. The parents, one teacher and other businessman used to pressurize her to get good marks and perform better than her neighbor friend. Even she was, getting 80%, they're not happy, because if the neighbor is having 82%, they used to become sad. And they used to always tell, at least get more than her. See, this is a very bad situation in our society nowadays. The comparing and pressurizing our children, and making them sick. Progressively, her pain became worse, and she started getting even neck pain, knee pain. She used to be very anxious in the morning, even in bed, while getting up, thinking of her going to school. So she used to say everything in the morning, oh, today I have to go to school. Since her mother was also a patient of rheumatoid arthritis, it alarmed her, and then she was taken to rheumatologist. See, nowadays we go directly to the specialist. After thorough examination and lab investigation, she was diagnosed as rheumatoid arthritis patient. She was given a mild course of steroid, painkillers, and she became better for time being, and then again she got the problem after months. See, this is the report. ESO was 25 and RF factor was 24 and CRP was 19.8. So everything is raised. She's just a girl of 13 years. Same thing highlighted. She was given now. They took to Ayurvedic doctors for a few months, but that reduced her weight drastically without relieving joint pains. Nowadays, she can't do any physical or mental work. See why they discontinued Ayurvedic, because they said there are a lot of restriction about diet, and then she was not able to cope up with those diets, and she became very weak. So this frightened her parents, and then they changed the place from Medicare to Mangalore, but her suffering continued. Finally, they opted for homeopathic treatment. So we have taken the case. Physically thin built, looks fragile. She's a matured girl. I mean, puberty already achieved. Menses regular, painful on the first day. Bleeding is scanty. Joint pain also increases around the menses. Chilly but extreme of heat is also intolerable. Sweating, palm and feet. White dots on the nails. Appetite good like pastries, cake, chicken. Gas, acidity. I mean, this causes gas and acidity. Chicken. Constipated and hard stool difficult to pass, sometimes once in 2 days, especially before and during menses. She was constipated. And mental picture is mild and sensitive, no anger at all, shy, anxious, nervous, and all the problems increases and caused by anxiety. Can't face stage and crowd. Anxiety increases her sweating, feels like hitting herself, feels like crying and sensitive to touch. Father is 50 years old having diabetes. Mother 45 years having arthritis. Brother 16 years old recurrent cold cough. And then maternal grandfather, paternal grandfather didn't have much problem. Now, what is the problem? What we understand about the patient? What the whole picture of the patient is: sensitive, anxious, timid, easily affected by comments and criticism, who is also stressed because of the parents' pressure, who is chilly, like to be in sun, is suffering from joint pains, diagnosed as rheumatoid arthritis. So this is the definition of the person as well as the complaint. When we analyze the case, we have to find out what are the common, what are the uncommon. So common symptoms first we see. Back pain, knee pain, these all pains are common. Frequent cold cough common, nose block common, RF factor positive common, diagnosis rheumatoid arthritis. So these are the common symptoms. Minus this, all other symptoms will be uncommon. Uncommon is pain aggravation setting, all these modalities, amelioration by sun. Anxiety causes and increases all the complaints. Painful menses first day, sweating palm and soles, craving for cake and pastries, constipation during and after menses, mental and physical exertion aggravates. So these are uncommon symptoms. Now, when we summarize and come to totality, few most important symptoms are: we have causative modalities. What? Anxiety and emotion. This is a very sensitive person. Any emotion, any anxiety aggravates her problem, and they have caused the problem. Modalities we have found: physical and mental exertion aggravates. Concomitant, what we have got is menses before and during constipation, and tendency to get affected by cold. Location and sensation, we have got joint inflamed. So see, we have got causative modalities, concomitant, and location sensation. So what is available in the case? Cause, complaint, modalities, mental state, concomitants. So we have to ask ourselves, which repertory may be anything, which method you will feel. So it's the Bogers. And these are the rubrics taken. Emotion aggravates causative modality. Emotion, fright, anxiety aggravates. Exertion, mental aggravates. Exertion, physical aggravates. menstruation, constipation before and during, cold taking and its effect. This is there in sensation and complaints in general, that chapter. Joint inflamed sensation and complaints in general. Then we have done repertorization, and we found Nux vomica, Silesia, Pulsatilla, Bryandia. These are the medicines. Since we know the person and sun emulation chili, medicine which comes prominently are Nux vomica, Silesia. Emulation by sun, white dots on the nails. This will finalize the remedy, and she was given Silesia. And she was just given for 1 month. See, this case also very clear-cut totality. And very clear-cut totality means you can predict the cure. I have seen in our practice that if the case is having very clear-cut modality and indication, you can say you are going to be all right. There is no doubt. Because totality individualization is the only basis for our prescription and getting result. So Silesia 30 was given, and then she was asked to come after a month with the investigation. So she has come after a month. All joint pains are better. She can write and doing all the homework. She is able to ride the bicycle, which she was not able to do so. Constipation is better. Menstruation pain also is better. And then overall she is better. These are the reports. We can see RA factor, ESR. RA factor has become normal. ESR has come down. So, and symptoms are also better. So she was given Silesia 200, and then she became slowly better. Ovarian cyst case, I'm not going to read much, but here we found that brief discussion of the patient. She is thin-built housewife, stays with in-laws and husband in a joint family. Got married at the age of 21, and after completion of her degree, wanted to work as a teacher but could not do so because of family background, as no female were allowed to work. She feels difficulty to pass time as husband goes for work in the morning to a long distance and returns only late night. She feels unfortunate herself because she could not conceive, whereas other co-sisters were having children. She has two co-sisters having 4 and 3 children respectively. Menstrual history, I will not go. They are the symptoms which are very important. Before menses, mood swings, feels irritated, and a kind of fear that menses will appear and will get severe suffering because she used to have very, very painful periods. Very sad and does not want to talk. Vomiting along with the pain mainly in the right lower abdomen, faints during menses, severe weakness, cannot even walk and talk in symbolic language during the period, see so much of pain. Sadness 3, increases amounting to depression. Menses character irregular, profuse, dark and clotted. Aversion to food like salty, does not like vegetables, desires sweet and all kinds of non-veg. Hot patient, does not like to go in sun, sweat profusely and very uneasy with the sweat. Mind, she does not feel that there is any happiness left in her life, and she does not get pleasure in anything which other family members enjoy. Even with the husband, she doesn't feel anything. She does not feel good in company, neither in sex. Does not like to do any work willfully, though she has to work the whole day as a housewife. She is very slow in thoughts and as well as in any mental and physical work. Sometimes she keeps doing things while others finish their work. She does not feel like going in any function as everyone asks about children. She does not mingle with people and prefers to be alone and keep thinking. She feels she is very slow in everything. She hates people, including her husband. So in this, what is available is qualified mentals and physical generals. Totality we have made. Sadness. See, sadness is the biggest rubric in Kant's mind chapter. It has maximum number of medicine. So sadness as a rubric cannot be taken for repertorization unless it is qualified. Qualified means unless associated with some symptom, like sadness menses before. So this becomes qualified mental. Sadness menses during. So both are taken as a mental symptom. Indolence, aversion to work. Indifference, pleasure to. Aversion, salt. Desire, sweet. Faintness, menses during. Vomiting, menses during. Menses, copious, dark, and painful. So this becomes a good totality for no doubt Kent's. And then repertorization was done. I don't think it's very clear. Here CPI and natrum, two medicines are coming. After repertorization, two main medicines are coming as prominent indicated medicine, CPI and natrum. See, this is a very important step in repertorization. When the final group of medicine comes, we have to find a correct remedy because most of the medicine which come finally, they cover all the symptoms, all the rubrics. So unless we understand the patient, I don't think we can select a right medicine. So we have to differentiate on the basis of few symptoms which are present in the patient. The following understanding about the patient help to finalize the prescription. See, one is hot. Patient is hot, aggravation sun. Then CPR gets less mark. I mean, it's chilly patient. Then does not like sun. This also goes in favor of night. Strong aversion to company and take talking to people. It's no doubt CPR also has, but other two prominent things decided the medicine, and she was given natrum 200. And after 3 weeks of treatment, she came, and then pain was tolerable. The first time she said that I was so much relieved because the pain was less, and she could avoid taking injection. She was telling, even if my cyst is not gone, I don't mind, but the pain should be all right. Feeling of sadness was less. Now her ultrasound was taken after 3 weeks. So we have seen a reduction of size. Earlier it was 6.4 into 6.2. Now it has become 5.3 to 2.6. This is the ultrasound report. 5.3 into 2.6, the ovarian cyst. Then she was again given natrum 200 and reported for another 3 weeks. And here, that means total 6 weeks, the cyst has been disappeared. You see here, ovaries are normal in size, shape, follicle. Now follicle also has come, and afterwards she became pregnant also. Now what has come is, we don't know from where uterine fibroids have come, very small size, but that doesn't interfere, and she became pregnant also. Finally, just one more case. This is also a reference method. This came just 2-3 weeks back. This is a case of a pregnant lady where there were no cardiac activity in beginning of, in 5 to 7 weeks of pregnancy. 28 years reported with the problem of early pregnancy. The USG shows that 5 weeks and 5 days gestation with yolk sac without embryo. See what important thing. You will notice how homeopathy is so important. And no cardiac activity. So this ultrasound report says that there is gestation, but no yolk sac, no embryo. Yolk sac is there, but no embryo, and no cardiac activity. She was advised to abort the dead embryo. She approached to inquire whether any treatment is available in homeopathy. She was very tensed because she said she had abortion of 6 to 7 weeks in the earlier pregnancy. And this time also the obstetrician has told to go for DNC. But the obstetrician said you can wait for a few more days and see. Then she thought of homeopathic medicines. See, this is very clear. Intrauterine gestation sac some centimeter, corresponds to 5 weeks, 5 days. No embryo seen. Yolk sac seen. No cardiac activity visualized. Cervix normal. She had, now few symptoms we tried together. She had frequent desire to pass urine, with only passing of a few drops. Urine is scanty and colored. Thirstlessness. And she had abortion in early pregnancy last time. Then we referred some books, whether 5 weeks you should have cardiac activity or not. So what is the reference telling is usually in a healthy fetus, the heart rate increases from 110 beat per minute at 5th week of gestation to 170 beat per minute at 9th week of gestation, and from then on there is a gradual reduction in heart rate that reaches to a mean value of 150 at 13th week. So heartbeat should be present at the rate of 110 at 5th week. This is should be normal. Otherwise, it's a not normal gestation. So a rubric was referred in Kant's repertory in under abortion, and there is one rubric early months. So last time there was early months abortion. This time also going to be early abortion, assuming that that rubric was referred. And then with the above symptoms like frequent urination and thirstlessness, scanty and colored urine, a medicine was selected, and that medicine was epismel 30. And since we had only few days time, 4 pills every day morning empty stomach was suggested. And after completing 10 days, she was asked to come with a repeat ultrasound. And to our surprise, in this case, I really owe credit and all importance to homeopathy. Homeopathy is a miracle, I can say. See in this, here, cardiac activity visualized. Fetal heart rate is 137 and a gravid uterus appears normal. So a single viable intrauterine pregnancy corresponds to 7 weeks and 0-day gestation. So this was a real miracle, which happened because of repertory. Otherwise, epismel I would not have thought. I would have thought maybe CPR or some female remedy. So this is a real credit to repertory and homeopathy. This is the result. I mean, ultrasonography. She was advised to discontinue epismel because it came everything normal, and then she was given constitutional medicine once a fortnight to continue for the whole period. So, what are the uses of repertory? Just to summarize, to find out simillimum as a reference book and the study of materia medica, study of comparative materia medica, also know the intensity of symptom, helps to find a complete symptom, formulating questions, constant use to improve materia medica knowledge, second prescription, source of symptoms also we can understand from these repertories, synthesis of new rubric also. So these are all different work of repertory. Conclusion I can mention, every homeopathic physician should expertise himself or herself in art of prescribing by emphasizing on repertorization. This is the only right way to therapeutics. Art of prescribing is learnt by applying the principles into practice without violating norms. Follow the guidelines given by our stalwarts. There is no shortcut in learning, and in case of practice of medicine, not at all. Whether it is repertorial or non-repertorial, mechanical similarity will always lead to failure. Repertorization done properly leads to constitutional, miasmatic, and all kinds of prescription, depending on the totality. What is the need for repertory? One or two quotations I will just say. The need of repertory comes from the character of homeopathy itself. It's a beautiful statement which I like very much. The author of Synthetic Repertory has written, see, we can understand the homeopathy is a very, very logical subject. See, everything logic, and repertory is another thing which is based on the logic. So the character of homeopathy tells you that the repertory is required. You have to go from vast to single, group to single. This is a logic. And then William Gentry says there is a need, and it must be truthfully said, an urgent demand for a repertory, which will enable the physician to find quickly, certainly, and desired symptoms in mathematica together with indicated remedy. The proper use of repertory is indispensable to the prescriber, especially in complicated and difficult chronic cases. We can't avoid that. The mathematica is so vast that it is not possible to carry it all in memory, nor it is considered by experienced prescribers. Final, I would say, and our Pires Smith also has said, we do not have a choice. What he says is, no one can know everything, and that is why all honesty. One must admit that no consensus homeopathic doctor can practice homeopathy in a serious and really scientific way without a repertory. To meet the challenges of exploding mathematica, the homeopathic repertory was born. Thank you all very much, and I'm very happy that you all are still there to listen to me. So now over to organization. Please take care, the organizers.
Good evening,
Hello.
sir. Uh, it's so excellent to learn from you. We are waiting for our moderator tonight, Professor S. K. Bhattacharya, sir. Professor Bhattacharya, sir, please. And let me get in touch with him.
Uh, till now, we have not received any question, so it may come. I think if it comes, Dr. Bidyut, could you share on screen? Hello.
Hello, sir.
So actually, we have heard a very, very important and elaborative expressions on repertory from Dr. Tiwari. I
Yes.
practically I am telling you, he has presented it very simply and very nicely. The importance of it, what to do, and what to do, which is really, uh, I don't say about others, but even myself, I am telling you, I have been much benefited with his speech. And whatever I told you, I have very little knowledge of repertory, but I practice repertory every day. In my practice, I use repertory either from computerized or even books, because sometimes I'm not satisfied with the computer. I usually refer the books. So some problems which I was facing, I have, after listening to his speech, I think some of the problems will be corrected. It is very useful, and the cases he has shown very nicely how it can help in acute disease, how it can help in chronic disease. Both are very, very important. And one thing he has not mentioned, that use of repertory is also essential in epidemic conditions. and he has we have discussion in this matter in CCRH in a meeting, but today he has not given that link. So that is also one point he has not mentioned here. In epidemic cases, repertory is a very essential. Of course, he has told about the acute cases. So his speech was very nice. I am thankful for it. And if there is any question from anybody, that can be sent through WhatsApp to Dr. Bidyut Mukherjee and Dr. Tiwari. Even if it is not now, I think he will enlighten or highlight the answers through WhatsApp for information of all. Now I pay my thanks to the organizers. Most of the organizers are my young brother or my students. So I pay my thanks to them that they are organizing it, and it is a very important scope for everybody to enlighten or to repress their knowledges. So thank you.
Thank you so much, sir. And we all are so happy and proud to have you, Professor Tiwari, sir, on screen with us. I'd like to request also to bring on Dr. Pralay Sharma, who, on behalf of NIH Alumni Association, will do the appeal for all the alumni. Over to you, Dr. Pralay. Pralay, please unmute.
Thank you so much, Dr. Mukherjee. And I think now I am audible. And it was a very wonderful evening today that we have listened from Dr. Tiwari and Dr. S.K. Bhattacharya sir. Dr. Kalyani is there, Dr. Mukherjee is there, and of course our uh, junior brother, Dr. Rajat Pal was there. So it was a wonderful evening to us, and it was quite informative. What I usually do, and that has become my duty to give an appeal to all the alumnus. And for your information, I would like to say that in National Institute of Homeopathy, now we are running with 23rd batch of postgraduate training, and 21, 22, 23 are in the course. So 20th batch and back are our alumnus. And in BHMS, we are running with the 28th batch. The 27th batch and backwards are our alumnus. Right now, we are, as we calculate, it could be 2,600 number of alumnus, including our respected deep NIH ex-students. We are there. We will be reaching 3,000 nearby. And to all of them, this is an honest request to all of them that you all might be knowing that the Alumni Association not only hosts a webinar, they do a humanitarian ground, they are working into it, and they organizes the medical camp as well as they stand with the alumnus in their districts. So that is the reason that we do have a benevolent fund, and this is in fact a uh, preparedness fund in connection with uh, the health of our alumnus. If someone is uh, truly and seriously sick, we contribute to them, to their family. And if we lose someone from our alumni association, we stand with their family members too. So this is our motto and target. And to fulfill this target and motto, I would like to request on behalf of the alumni association to all the alumnus to contribute sportingly, and they will contribute in a sense that they can contribute little amount of money to highest amount of money. It could be 100 rupees, it could be 200 rupees, it could be a 300 rupees, it may be 500 rupees and above. So I request once again to all the alumni to be with the alumni association, not only in regard with the webinar and seminar, to stand with the medical camp as well as to stand with the families of the alumni. With these few words, I request Dr. Mukherjee to proceed on with the webinar today. Thank you so much. Thank you so much, everyone.
Thank you, Dr. Pralay. I request our respected President, sir, Dr. Kalyani, to give his vote of thanks and our future plans for 50th CME. Over to you, Kalyani, sir. Sir, please unmute.
Am I audible now?
Yes, sir.
Yes, sir.
Uh, I am really grateful. Rather, Alumni Association is really grateful by getting these two nationally brilliant scholars of homeopathy. I pay my homage and respect to both my senior brothers, Dr. S.K. Bhattacharya and Dr. S.K. Tiwari. Thanks to my brother, Dr. Rajat Pal, Bidyut Mukherjee Prolay, for participating in the seminar. Thanks to all the viewers, those who have already viewed the CME, and in near future, those who will see through YouTube's. They're really a brilliant CME, in my opinion. Anything addition to this CME will make this CME inferior in quality. So I don't want to add anything. Simply, I cannot but to add only one thing, that I am in homeopathy for last 46 years, since 1974. I was exposed to different type of brilliant teachers on repertory, many classes. But today's CME is a landmark to me regarding repertory. In shortest time, briefest way, gems of repertory has been distributed nicely by Professor Tiwari. I really pay my respect. And this, what I think that simply this CME, if any student or teacher is exposed to the CME, definitely he will be encouraged to start handling repertory. Such a brief, to the point, combination of theory and practical, the really brilliant CME. So really, we are very much thankful. We are immensely helped getting inspiration from Dr. Tiwari. And our earnest request to both our seniors, Dr. Bhattacharya and Dr. Tiwari, to come to with us, to encourage us to continue the CME and to provide us your experiences that will help all of us immensely. You are the really the pillars of homeopathic system of medicine. You inspire us. That inspiration we will try to convey to our juniors, by which a tradition of homeopathic climax in India, in the whole world, should be continued. So really thanks to all, many thanks to everybody who has participated, who has conducted, our backstage editor, everybody, to come with us and to participate in the CME. Thank you very much.
Thank you, sir. And with this, we are returning to our backstage editor, Orko Mukherjee, and we'll be back on 22nd of May with two young dynamic speakers and with a uh, very interesting and a successful subject. Over to you, Orko.
Thank you all. Thanks for watching. I hope you have enjoyed this video. And if you have enjoyed it, please give it a like. Do share it with your fellow homeopaths. And also subscribe to our channel for more upcoming CMEs like this. And also, if you want to get auto-generated e-participation certificate, just go click on the registration form given in the description below. Just click on it, and you have to fill up some little bit of details, after which you will be getting a e-participation certificate on your Gmail. And also follow us on Facebook, like our page on Facebook, follow us on Instagram, Twitter, and to keep up with other updates related with this and what NIH Alumni Association is doing on the background. To keep it up with this, join our Telegram channel. And with this, thank you all for having me, and thanks again for watching. And with this, I say good night to all of you.